Thank you, Mr. Chairman. This amendment would delegate authority to the Secretary of Health and Human Services to negotiate bulk price discounts in the purchase of prescription drugs for the Medicare program. It's long been an astonishing fact that the biggest purchaser of pharmaceutical drugs on behalf of Medicare beneficiaries is by law prohibited from working out the best deal for the taxpayers by using basic market principles, a seller and a buyer negotiating for a fair price. A seller wants to sell high, a buyer wants to buy low. That is true in every commercial interaction. That's the way it is. And it was a unique and really unexplainable provision in the Medicare Part B program, or Part D program, where we handcuffed the Secretary of Human Services from being able to get the best deal. Now, the argument that some folks make is that negotiation doesn't work, but what we have is a situation where we buy wholesale but have to pay retail, and it's resulting in enormously high prescription drug prices. There was a study that was done that showed that, in fact, the 20 top pharmaceutical products we're paying in the Medicare program about 58% more than we pay in other programs. Medicaid oftentimes has negotiation. The VA program has price negotiation, and they get a much better price. We're all struggling here right now about the pay-for to extend the CHIP program that we all support. So what is the problem with it's not imposing a price, it's negotiating a price. And by the way, when Elijah Cummings and I had an opportunity to meet with President Trump about this, he made it quite clear. You know, if he was negotiating for something in one of his buildings, he's going to try to negotiate a good price. And if he's buying 1,000 mirrors, he's going to get a better price than if he's buying 10. And he totally gets it, that this makes sense to do. And what he also gets, and what I think every one of us can get, is that the people we represent are really struggling at their kitchen table trying to figure out their budgets. And a lot of times they're having to make a decision about whether they can take the full prescription that's been provided by their physician or not, because the price is too high. And it's hammering the taxpayer, putting enormous pricing pressure on people needlessly. This is not about restricting what the pharmaceutical companies do. It's just saying, hey, there is going to be a price negotiation here because the government is buying in bulk. Negotiation works. I'll give an example, and it involves Tommy Thompson, who was a governor of Wisconsin, but later became our Health and Human Services Secretary. But in 2001, when we had to get a lot of Cipro, the price was $4.67 per dose at the federal supply schedule. The federal supply schedule had it at $1.77. During the anthrax scare, Secretary Thompson purchased 100 million doses for 95 cents and had an option to purchase another 100 million at 85 cents and a third round at 75 cents per dose, as opposed to the 467. I mean, it mystifies everybody I've ever talked to when they're told that this Congress has passed a law saying we can't negotiate through the Medicare program to get a better deal for them and for the taxpayer. We've got an opportunity to do it. This is the time to do it. It's money that we can save for taxpayers and consumers. So, Mr. Chairman, my hope here is that we can begin this process of focusing on the excessive cost in various components of our healthcare system, rationalize them, introduce market principles like negotiation, and get a better deal for taxpayers, for employers who are paying for healthcare for their employees, and for consumers as well. And I yield back the balance of my time.